Good morning, everybody. Thank you for joining us for the state's response to the pandemic. As always, we remind people, please continue to use the tools we've given you to be able to slow down the pandemic. That means keeping that 6 foot of distance between you and other people when you're in public, wearing a mask when you go to the store, washing your hands often, 20 seconds at a time. Please, and again, one of the key things is make sure that if you have that fever, that cough, or if you've lost sense of taste or smell, that you stay home so that you don't spread the virus. Obviously, we want you to go get tested to make sure, but I know Nebraskans like to kind of power through when they get sick, but this is not the time to be able to do that. So please do that. And of course, you can take advantage of Test Nebraska to be able to get tested. I actually got tested on Sunday, and I got my test results back in less than 8 hours. So we're generally getting those back in 24 to 48 hours. I think over the last 7 or 14 days, we've been doing it in about 14 hours. So again, we're getting those test results back very quickly. So please sign up and do testnebraska.com to be able to help out with that. We have delivered, 676,000 test results back. So a lot of test results coming back from testnebraska.com. And again, avoid the 3 C's, those crowded places, close contact, confined places. Those are places where the virus will have more of an opportunity to spread, so please continue to avoid those as well. And of course, all of this is about making sure we preserve our hospital capacity. We're currently at 185 hospitalizations. We have 37% of our hospital beds are available, 39% of our ICU beds are available, and 79% of our ventilators. So we have robust hospital capacity, and we're at a stage right now where we've hospital beds. That 185 is about 4.5% of our overall hospital beds. It's a stage where we're back in September. So good news there. Continue to use these tools to be able to slow down the spread of the virus so that we can continue to preserve our hospital capacity. Obviously, also one of the things we're experiencing right now is extreme cold. So we want people to take precautions, make sure that you're putting proper safety supplies in your car if you're going to be driving around. Have them at your house. We talked about that last week as well. And one of the things we've experienced with this cold is the rolling blackouts. So first of all, I want to thank all of our utility and power workers who've been at the plants working to keep power generation going, and our linemen who are working to keep that power generation going. A lot of people working around the clock to be able to do that. The utilities like NPPD and OPPD and LES have all asked people to turn down their thermostats. We appreciate people who are making those sacrifices. However, these rolling blackouts are completely unacceptable. This is the United States of America. We are not some developing nation who has an unreliable power grid here. We have to have a conversation in this country about the power sources that are supplying energy to our power grid, because we cannot have these rolling blackouts at a time when we have these frigid temperatures. So I'll be working with state senators, other governors, talking to power executives about how we move forward to make sure this does not happen in the future. My take on what we've seen, however, is that we've got great reliability with things like coal and nuclear. In fact, our Gerald Gentleman plant, I think, is providing over 50% of our state's energy, in fact, up to 57%. And that is a source that is not intermittent, and you can store the energy on site. Same thing with nuclear. We have other sources like wind power that are intermittent and you can't store, or natural gas where you can't store. One of the things that we've experienced with this cold weather is those natural gas pipelines freezing up, so apparently we have to have a better infrastructure for that. And if we are too reliant on those sources, then we're going to see these types of rolling blackouts. And you can just imagine if radical environmentalists get their way and pass the Clean Power Plan or the Green New Deal, that these situations will become even more dire. So we have to have a conversation in this country about our energy mix to make sure we continue to have reliable sources of energy like coal, like nuclear, to be able to make sure this does not happen again. This is utterly unacceptable that we have to endure these rolling blackouts, especially at a time when it's so cold. So that's what we'll continue to focus on, and I'll be working with folks to be able to make sure that we start having these conversations and that we address this issue with regard to what our power, the proper power mix is, and how to make sure that this does not happen again in the future. Second thing, I want to get into vaccines. We are going to have a press briefing tomorrow. We'll get into more detail. We have delivered 303,000 vaccines here in Nebraska. And I want to just spend some time talking a little bit about Phase 1B and clarify what we're doing there. So as I talked about last week, in Phase 1B, we are prioritizing, I've asked the public health departments to focus 90% of their efforts around folks who are 65 years and older. The reason we're doing that is that 83% of the deaths we've had in the state have been from folks who are 65 years or older. And if you take it down to 55 years and older, that's like 94% of all of our deaths. Age has been the single biggest factor that we see in the data from Nebraska, this is Nebraska data, with regard to who's most at risk for dying if you get coronavirus. And that's why we've asked health directors across the state to really focus on that category. Now, we have given them some latitude, that 10%. And I want to walk through that because teachers are in that Phase 1B category, that top tier. However, we have other groups in there that are prioritized ahead of that because it relates to public safety. So when you look at the public safety, and this is again what we've directed public health directors to do, is focus on that with that 10%, focus on the public safety aspects. That means, again, first responders and law enforcement are tops in that category. That's public safety, making sure that the people who are keeping us safe are being prioritized. Also, we have critical utility workers, those critical infrastructure workers that help us keep the power on, the heat going. And certainly during this cold snap, we can all see why that's important. That's a public safety issue. Also in there is the staff at homeless shelters. And again, especially when we have, again, this cold weather is really demonstrating, when we have very cold weather like this, we can't have homeless shelters closing down because those folks don't have any place to go. And so they'd be at great risk. And again, that's a public safety issue to not allow those shelters to be open and have a place for people to go. So that's a public safety issue. And then finally, in that category, in Phase 1B, that is prioritized in public safety is our correction staff, or so the staff at jails and prisons. And again, it's a public safety issue. We have to maintain the staffing at those facilities so that the inmates can be taken care of and that they're not, in danger of having a staff shortage there or whatever. So that's why that's prioritized there as well. These are public safety issues, making sure we keep our corrections and jail staff part of that prioritization in Phase 1B in that top tier. So those are the folks that are prioritized for public safety reasons and why they're in Phase 1B right behind when we're talking about 65-year-olds and 75-year-olds, and those are the first people that should be doing it in that 10% category. And so Dr. Adipur in Douglas County, for example, is doing it exactly right. She's doing exactly what she's supposed to be doing in prioritizing things that have to do with public safety as part of her 10% allocation that is not focused on the 65-year-olds or higher. So I want to just clarify all that Dr. Adipur is doing exactly the right thing in Douglas County. All right, so next is property tax. So last year, the legislature passed and I signed LB 1107. And this is a tremendous step forward in providing property tax relief. It will provide, when fully phased in, an additional $375 million in property tax relief, as well as codifying the $275 million we have in the Property Tax Credit Relief Fund. In my budget proposal this year, if you do all the things I proposed in my budget, we can actually provide with the Property Tax Credit Relief Fund, LB 1107, and the Homestead Exemption Program, $1.36 billion in property tax relief in the upcoming biennium. Now, the way 1107 works is that you will receive a refundable income tax credit based upon the property taxes that you pay to schools. And that is part of the program here that we want to talk about today. And so our tax commissioner, Tony Fulton, also our property tax administrator, Ruth Sorensen, are here to describe a tool that we have at the state of Nebraska to be able to help you determine what that credit will be for you so that you can claim that credit on your income taxes. So again, this is going to be a refundable tax credit, which means that even if you don't owe income taxes to the state of Nebraska, we will still give you a check for that difference. So if you don't owe income taxes, we're going to write you a check for that refundable property tax credit. So again, this is a great way that we're continuing to help provide property tax relief here in the state. It's a great program, 1107. And so we've got our tax commissioner, Tony Fulton, who's going to come up and talk to us a little bit more about that. So Tony, I'm going to have you come up, and I think Ryan, you're going to be able to demonstrate the tool here, so please come on up.
Okay, very good. Thank you, Governor. Well, hello, Nebraska. We have some good news to share, and it's always nice in these times. Thanks to the work of Governor Ricketts and the legislature, for the first time ever, you'll be able to claim a refundable income tax credit for a portion of the school district taxes you've paid. And as the governor emphasized, a refundable credit. That means that even if your state income tax liability is zero, you will still receive the balance of the credit as a refund from the state, but you have to claim it. It's that time of year when we must file our income taxes, and we are encouraging Nebraskans to use our Nebraska School District Property Tax Lookup tool, again, as the governor emphasized earlier. Use this tool to determine precisely how much credit you're entitled to based on the property taxes you've paid, the school property taxes you've paid, that is. And this is the important point, and the reason why we want to make this a point of emphasis in this news conference. If you claim more credit than you're entitled to under the law, or if you claim a different amount than you're entitled to, your refund could be delayed, and we don't want that. So please use our lookup tool to ensure this doesn't happen. This will ensure that your refund will come in an efficient manner, in a timely manner. Nebraskans can access this tool at our website, and that website is revenue.nebraska.gov. We have the tool featured prominently on our website. Again, it's revenue.nebraska.gov. I'm going to turn this over to our property tax administrator, Ruth Sorensen, who will give you a short demonstration of this lookup tool. Ruth?
Very good. Thank you, Governor, and thank you, Tax Commissioner. It is a pleasure to be here indeed because this is a very important lookup tool for all property owners in the state of Nebraska that own property, real property, of course. And on the screen to my left is the Nebraska Department of Revenue website. And if you go to the website, it's under the What's Featured on the main page. And so as we go down the main page, you'll find the lookup tool that is being demonstrated here. So we begin with the lookup tool, and this is going to assist, again, taxpayers to understand what their allowable school district taxes paid on their parcels for the tax year 2020. It's important that the taxpayers understand that this is for real property only, and that it is for what we call qualified school district taxes. So this amount may not match up with the tax statement that you receive from your county treasurer. The property owner will begin by selecting the county where their property is located. In this case, we're going to be using Lancaster County. There is a box to the right for the parcel ID number, the next field to be completed. And if you don't know your parcel ID, if you don't have your real property tax statement, which is what we strongly encourage you to use for your parcel ID, some counties call it parcel number, there is the lookup tool to the right of the box there, and it brings up all the websites for all the counties, all 93 counties. You'll note that on some of them there's a statement indicating that you will have to use a leading zero, and that is because of a vendor issue that we have with some of the websites. Not all, but just a few counties. The other thing that's important to know is the data that we're using on this lookup tool was gathered and compiled from all 93 county treasurers or their vendors. And we took all that data and compiled it so it would calculate the credit amount for our taxpayers. So if we go back, I've selected a parcel ID that we'll be using. And so we already know our parcel ID, so I don't have to go to that website. So we're going to enter the parcel ID, and the tax year will be 2019. Then we hit next. And then we want to verify this information to make sure that we did, in fact, enter the correct parcel number. Now we know it's correct, so we're going to hit the next button. And then here, on this screen, it's asking if you sold your property. So if you sold your property during the year, you'll get the partial credit, and then the new owner will get the other partial credit. So here you would enter yes if you did sell, and you'd enter the date of the sale. However, in this case, this property was not sold, so we're going to answer no to both of these questions and hit next. And here now you can scroll down and you can see which school district taxes are being calculated for this parcel, which should align with your real property tax statement. And as we scroll down, the red amount is the amount of the credit that this property owner will receive once they calculate that amount on the Form PTC. If you paid more, there's a link up there where you would indicate you paid more, and only the red amount on this tab will change. And so you would then enter that red amount. This looks like it's $2,718. So then we have this information, we click next. And again, this is the final screen. We encourage you to print this for your records. If I had more than one parcel, I would go back and add another parcel. So if I owned a couple parcels of ag land ground, and then I also owned a residence, I could go back and add that parcel, and this table will accumulate, and it will calculate that amount for you, the total amount. So this amount, the 2007-18, is the amount that we are going to enter on the Form PTC, which is also on our website. And Ryan has it there for us. So we are going to enter at 2007-18 on line 1, line 3, and then in that box, line 5, where we enter the owner, the county number, the tax year, and the dates that I own that property. Now, the county number is not the number on your license plate. If you don't know your county number, you would go back to that website, that link that had the websites, and it lists the county alphabetically and numerically. So Lancaster is 55. So I know that Lancaster is 55, so I have put it there on this form. Then I go back up to line 4, and I take that 2007-18, and this year, the percentage of credit is 6% based on the funds available. And so in this example, this taxpayer would enter $163, as is shown there on the screen. Then, again, we print this form and submit it with your 1040N, Nebraska income tax return. And then this amount will go on your Nebraska income tax return to show the credit. And that is on line 36 of the Nebraska income tax return. And you can see that we have pre-populated that with $163. And so this taxpayer would complete their 1040N, include this line 36, and then calculate the amount of refund or amount owed. And that is the quick demonstration for.
So Ruth, a
Yes.
couple of things. Can you give out the URLs for the websites for the Department of Revenue? You also said the one for looking up your parcel ID, and then also what happens if you file your taxes electronically?
Okay, the governor's asked me to provide the website again. It's revenue.nebraska.gov, and it's under, we have a what's featured if we go back to the homepage. And so there's featured information, pardon me. And that red link there is going to bring you to what we call the landing page. And that there will contain as the governor's asking me to explain, the websites where you can look up your parcel IDs. And so there in the blue box on the second blue box, you can click on that, and that will bring up that document that had all 93 counties listed on it there. And the websites are linked there, and each county has their own unique website. And then his final question was, what if you file electronically? It would be the same process. You would go through this, filing electronically. We allow you to attach documents, and so you can e-file as well, which we encourage. Anything else, Governor?
Thank you very
Okay,
much, Ruth.
thank you, Governor.
All right, thank you very much, Ruth and Tony, for providing that tool to help our taxpayers be able to collect their tax credit as part of LB 1107 and get that property tax relief. Appreciate it very much. So stick around in case we have additional questions on that. All right, so we will have a press briefing tomorrow morning at 9 a.m. We'll do it here in the hearing room, and we'll do a vaccine update on that. We'll also have a press briefing at 10 a.m. Central Time, Friday, here in this room as well, so please stay tuned for that. And now we'll go ahead and get into the questions that were submitted by the press. So Scott Miller, KNEB, is asking, the Biden administration is apparently moving toward the removal of the hurdles to Medicaid eligibility. What does that, or will that mean for the prime level benefits under the Heritage Health Adult Program? Will they just go leaving the basic package for those who signed up for after Medicaid expansion? Well, we just found out about this in the last few days, and we think we've got a great community engagement program with regard to our Medicaid program here for the expansion. And so we will be responding back to the Department of Health and the U.S. Department of Health and Human Services about why this is such a great deal, not only for the folks here in Nebraska, but also for the federal government. And take it from there with regard to that program and see if we can work something out with them. Second question comes from George Lobby from the North Platte Bulletin. Residents of long-term care homes in North Platte have had their COVID-19 vaccinations, both doses, but are still restricted to rooms and can have no visitors per CMS, the Center for Medicare and Medicaid, which of course would be the same group that's doing our Medicaid expansion requirements. Can the governor persuade CMS to ease or eliminate those restrictions? He also goes on to say, a daughter put it this way to me, these people are dying of loneliness. I understand the governor has had a hand in allowing essential family caregivers to make limited visits twice a week. Appreciate if he clarifies that. So with regard to the visitations, we need to separate out a couple different groups. First of all, you have those skilled nursing facilities, and they are under the regulatory regime or regulated by CMS, that Center for Medicare and Medicaid Services. That's the federal government. So they set those programs with regard to when those visitations can come, and we, the state, don't have any direct ability to allow visitations in those facilities. But I agree with you, George. I will be bringing it up with the federal government with regard to limiting some of those restrictions because they are tying it to a positivity rate, and it's not clear how they're calculating that. And I think they're probably overestimating what our positivity rate is because statewide right now we've been, for the last couple of weeks, under 5%, which means most of our counties should be in that category, which would mean they would be able to start allowing visitations. So we'll definitely take that up. The second group is our assisted living, and those are under the auspices of the state. And we put out a rule with regard to 90% of the residents being vaccinated and 90% of the staff being vaccinated, you could start allowing visitations. We will review that as well because I do agree with the daughter you talked to here. It's important for the health of the residents to be able to see their loved ones. So yes, we wanted to take care to make sure they didn't get coronavirus, but with high levels of vaccination by both staff and residents, we believe these facilities can start allowing visitations, and that's important to their overall health as well, certainly their mental health. So we'll be reviewing that as well, so I'd say just stay tuned on that. Julie Anderson, Omaha World Herald. Nebraska is particularly low, 49th among states, in the number of first doses given per capita as of Tuesday. Is the state health departments or some other entity in the state holding second doses to ensure people get them on time? Or is the low number in some way because of the 21 to 28 lag between doses? Or is it a function of the fact that most people have had time to get their second doses for our healthcare workers who were first in line? So they're seeking some explanation. Actually, Julie, I got to tell you, I think your numbers are wrong. I don't know where you're getting that 49th in the nation. If you look at where we are, again, we were just checking the New York Times today, they had us actually for second doses at number 20 and a little bit down the list for first doses, but we were like at 87, we're over 87% of our first doses allocated being put in there. So not sure how you're calculating that. And again, if we look at the New York Times website and really focus on, again, second dose, because that's when you get the complete immunity, we're around number 20. We certainly want to improve upon that. We want to do better for both the first dose and second dose. But we're really kind of focusing on that second dose because that's when you get the complete immunity. So we will be looking to find improvements to drive that. But again, I don't know how you're calculating number 49th there because that's not the way we would, I don't know where that data is coming from because that doesn't seem to be consistent with the data that we're seeing here in the state or even that the New York Times has. Martha Stoddard, Omaha World Herald. What are your thoughts about federal officials looking to withdraw approval of Nebraska's requirements, on the community engagement and so forth, the work activities and other activities for Medicaid expansion patients to get the full benefits? And again, we think we've got a great community engagement program. We've got the opportunity here to respond back to the U.S. Department of Health and Human Services, so we'll be doing that to talk about why what we think is not only a great benefit to the people here in Nebraska, but also benefits the federal government. Joe Jordan, News Channel Nebraska. During his State of the State address, the governor said that if the legislature doesn't enact property tax spending constraints, the people of Nebraska will take matters into their own hands. Is the governor considering taking the lead on this, for example, putting his own money into a petition drive similar to the actions he took to reinstate the death penalty in 2015? So actually, I hope the legislature actually works on this and passes LR 22CA, which will then put it on the ballot for the people of Nebraska to vote on. So I am not planning any sort of ballot petition drive because my hope is that the legislature will take this up and put it on the ballot for the people of Nebraska to decide next year. And with regard to that, there was a recent editorial or local view in the Lincoln Journal-Star here that was a California resident who has moved to Nebraska and talked about his experience with Prop 13, which was California when they actually did do a voter initiative and passed that property tax relief, in California. And that local view was saying that the same sort of environment that in California led to Prop 13 is the same environment this person sees in Nebraska right now. So again, this is not something that is isolated. This is something all across the state that people are mad about property taxes. And this person was just commenting that the same things that led to Prop 13 passing in California are the same environment that person's seeing in Nebraska right now. So that's what I see as well. Obviously, I didn't live in California, but I see people being really mad about this and taking steps and taking it into their own hands if the legislature doesn't act on its own. And I think it's better if the legislature actually acts and passes that legislation. Joe Dacre from the Omaha World Herald. Chris Rogers, president of the Douglas County Board of Health, said Monday that DHHS has mandated the pecking order for the distribution of vaccines that puts teachers at the bottom of Tier 1B, or 1B, but at the bottom of Tier 1, below the utility workers, first responders, homeless shelters, corrections workers, and so forth. And I think I explained, again, those are all public safety priorities, and that's why they are in that order. So. And so the answer is yes, that's the way we've ordered that because it revolves around public safety for that 10% that is not in the age 65-year-olds or plus. He also goes on to ask, would you approve if a county vaccinated a bookkeeper or secretary in a power company, someone who has little or no contact with the public before vaccinating teachers, per se? So again, what we're supposed to be doing is, again, really focusing on the folks who are mission critical there. So when it comes to utilities, again, it's those mission critical infrastructure workers that are involved, for example, of keeping the lights on and so forth. Now, what you may hear, because we don't want any of these doses to go to waste, is that somebody who may not be in that category, somebody like Joe's describing here, a secretary or so forth, that is getting that vaccine, but when you're probably hearing that, it's not because the person was signed up in line along with those critical infrastructure folks. It was somebody who was available at the end of the day, last moment, to be able to get the vaccine because we didn't want the vaccine to go to waste. So I just really urge people to be cautious here before they jump to conclusions about a lot of these things, because again, we don't want these vaccines to go away, so we are focusing on the things that are a big priority, again, 65-year-olds or plus, public safety and so forth. Where on your priority list for vaccinations have you put the people who are 18 to 64-year-old, the high medical conditions, and so forth, and specifically is responsible for vaccinating them? So again, what we're doing is we're focusing on the people who are 65 years older. We haven't addressed that other population. Again, because even when you look at all those other health issues, age is still the biggest factor in determining how at risk you're going to be if you get coronavirus. That's why we're focusing on the folks who are 65 years and older. So I would say stay tuned. We'll have more information with regard to the other groups as we move through 65-year-olds and older, but that's why we're focusing on the 65 years and older. Taylor, did you have any additional questions that were texted in? Okay. Questions from folks here in the audience? Andrew.
Both Douglas and Lancaster County are going to start vaccinating teachers. I don't know, where the other subgroups are. You said you agree with what Audie is doing, but it looks like they bumped teachers up in their priority over the security aspect that we're talking about.
So Andrew's asking, looks like Douglas County is going to start doing teachers, and a conversation I had with Audie yesterday is that she is actually working her way through the public safety group, and then she'll be getting to the teachers.
And what about Lancaster County? Do you have the same conversation with Lancaster County?
I have not had the same conversation with Pat yet with regard to Lancaster County, but again, our directions are very clear with regard to the order, and so I'm, trusting the local health departments to make that decision with regard to the public safety, but we also have given them some latitude if they think that there's something, an extraordinary reason why they need to do somebody else.
And what power do you have if all of a sudden health director doesn't do what you believe they should be doing?
So Andrew's asking, what power do we have if the health directors aren't doing what we believe we're doing? Well, again, we're making this a collaborative approach, so we work with the health directors with regard to this. And, for example, I'm going to take Douglas County because I was just talking to Dr. Poor yesterday. We make this a collaborative process. We talk about it. We, come to agreement on how we want to work on these things. And the health directors have input into as we work on the, the process here. So we really try to make it a collaborative process.
And it sounds like on the the energy situation that we have right now, it looks like there's a high demand for propane right now, and there's some wait lines that are starting to form at these terminals. Are you looking at doing something similar that you did before, as far as maybe waiving that wait time as part of their service?
Oh, okay, so Andrew's asking about, obviously with the cold weather, there's a high demand for propane and other fuels as well. What is the state going to do to help make sure we continue to provide that supply of fuel so there aren't long waiting lines and so forth? And as a matter of fact, yesterday, thank you for reminding me, Andrew, I was supposed to mention this and I forgot. I signed an executive order waiving the hours of service requirement for truckers who are hauling propane and other fuels so that we can be, really try and get a lot of this fuel delivered quickly. So thank you very much for that reminder. But that is one of the executive orders I signed, or the executive order I signed yesterday, to be able to waive that requirement on service hours so that we can have those truckers deliver the fuel that is needed. Yeah.
Regarding the rolling blackouts the past couple of days, do you feel that wind energy is to blame for filling the state in any part of this?
I'm sorry, what?
Do you feel wind energy is to blame regarding the rolling blackouts and what we saw in Nebraska specifically?
So the question was, do I feel that wind energy was blamed specifically for the rolling blackouts we saw here in Nebraska specifically? And here in Nebraska, actually, I believe through this entire thing, we have been a net exporter of energy. So while wind has not been able to really generate much power over the last few days, we've had other sources like Gerald Gentleman, like Cooper Nuclear that have been providing it. And talking with some of the other executives, when they've had problems, say, with natural gas, they've been able to convert turbines to fuel oil and so forth. So I think specifically here in Nebraska, we've kept a power mix that has allowed us to generate more energy than we're currently consuming. However, we are part of a larger grid, right? We're part of the whole eastern grid for the United States. And this is where I think we got to take a look at this, because while we may be doing it right here in Nebraska, clearly we have become too dependent on intermittent sources of energy or sources of energy where you cannot store on site. And that's why we're having problems being able to meet the energy demands, and we cannot allow this to happen again. Again, this is the United States, so this is not acceptable to have rolling blackouts on this. So we need to have a robust energy grid that has the proper energy mix and all the above strategy that includes wind and natural gas, but doesn't become over-reliant on those, so that when we have cold weather, that we can't keep the lights on and can't keep the heat going. This is why we can't allow the radical environmentalists to push things like the Clean Power Plan or the Green New Deal, because that, if those things would say, for example, shutter Gerald Gentleman, we would be in a dire situation here in Nebraska, because if you shut down our coal plants, we don't have a way to replace that in a way that is going to be reliable during cold weather snaps.
A question from Grant Schulte of the Associated Press. He wants to know who specifically is making the decisions about who to prioritize for vaccines.
So Grant Schulte of the Associated Press wants to know who specifically is making decisions with regard to who to prioritize for the vaccines, and that is the state. We, the state, are making those decisions. As I mentioned, we work collaboratively. We take the input from the local health departments, but we work with our public health officials here at the state to be able to put together those lists and then give that guidance out to the health departments. Yeah, Andrew.
I'm going back to the, the environmental. Some environmentalists will say that one of the reasons why we're having some of these extreme temperature swings that we have is because of global climate change. And that if we get rid of some of the carbon emissions that we have, we wouldn't see these swings like we have.
So the question is, some of the radical environmentalists are claiming the reason it's getting too cold now, not too warm, is because of the carbon greenhouse gases. So again, that's a theory, and that's obviously something of ongoing scientific debate. But at the end of the day, we've had cold weather like this before. This is not new. We've had temperatures dip this low before. And let me tell you, we didn't have rolling blackouts back then. And in talking to some people who are the generation before me, they had cold weather like this too. And the power didn't go out then either. So this is not new that we have cold temperatures in the Midwest occasionally like this. What's new is the rolling blackouts, and that's where it gets to, we've become too reliant on some of this intermittent energy, and we've got to really have a serious conversation in this country about the energy mix to make sure that this does not happen again. Yeah, Andrew.
Going back to the property tax credit that you have, I mean, why is it so complicated? Why can't this be automatic?
So Andrew's asking, why, getting back to the property tax credit, why is this so complicated? Why can't it be automatic? Again, what we're doing is giving a refundable tax credit based upon the school taxes you pay. That's going to be something that is going to be very individualized, right? It's going to depend upon what the individual piece of property you own and what the school was actually charging you for taxes. So this is not something that easily lends itself to be automatic. And of course, it's part of your overall income tax preparation, which again is something very individualized. So we've provided a tool here to really assist taxpayers in making sure they can claim their credit. But of course, that's part of the overall income tax return they're going to be preparing for the state. So it's just a piece of their overall income tax. It's not their entire income tax return.
And how concerned are you that some people won't know about it or some people won't take the time to claim this credit?
So am I concerned that some people won't know about it or won't take the time to claim the credit? Well, certainly that's part of one of the reasons why we created the tool, to make it easy for people, or easier at least, for people to claim that credit. And we're doing the communication right now. And for folks who have tax advisors, you ought to be talking to your tax advisor about that. So we certainly want to put information out there so people are aware of this, so they do take advantage of the property tax. And let me tell you again, this is like the #1 issue here in the state. People are mad about property taxes, so I do believe people will be looking to be able to take advantage of that property tax credit. Other questions?
Yeah.
Go ahead, Andrew.
Okay, if you're quarantined or if you're sick and you can't make your appointment, if you're scheduled to get a vaccine, do you drop off onto the back of the list again, or for some reason or other at that particular time you can't make it when you call?
Yeah, so Andrew's question is, say you have an appointment to get your first or second dose, and for whatever reason you can't make that appointment. Maybe you're sick, maybe you're quarantined, whatever. Just reschedule. You'll still be able to do that. And again, even with the second dose, there's a window there that is perfectly fine to be able to go back, and say you miss the precise date you're supposed to go back, You know, if you were supposed to go back at the beginning of March, but you couldn't make it for whatever reason, just reschedule and go back in and get vaccinated again. Even if you were able to have to do that a week or two later, it'd be fine.
Time for a couple more questions.
Couple more questions.
Should we be in,
We're clearly leaving Andrew too much time to ask questions because he just keeps coming up with them.
should we still be in the Southwest Power Pool?
Andrew's asking, should we still be in the Southwest Power Pool? The advantage of, so the answer, the short answer to that is yes, that being a part of a broader power pool allows us to be able to share energy. So while Nebraska normally is the one that is selling energy into the Southwest Power Pool, there are times, for example, when we have to do maintenance, say on Gerald Gentleman coal-firing plant, that we're going to be reducing our energy output in the state, and then we bring energy in from those other states. And so it does benefit us, broadly speaking, to be able to share that responsibility for generating load around a broader area than just Nebraska. But what we have to do is have that conversation, as that's why I've said very specifically, as a nation about what that power mix is. Because it's not even just about the Southwest Power Pool, it's about the entire country. And what is our energy mix to be able to make sure that we don't have these rolling blackouts when we have cold weather events like this? One last question. Oh, I say one last question, now all of a sudden Andrew's shy about it. Andrew used his limit up. All right, folks, well, again, thank you very much. Again, just a reminder, tomorrow at 9 a.m., we will have another press briefing to bring you up to date on the vaccines. Friday, 10 a.m. Central Time, we'll have another press briefing here again in this room right here, 10 a.m. Central Time. And please, again, remember to avoid the 3 C's, use the tools like keeping your distance, wearing a mask, staying home when you're sick. Oh, another thing I just want to remind people about again is that monoclonal antibody treatment. We have sufficient supplies here in the state. If you are in a category where you're 65 years and older and you contract coronavirus, please talk to your physician about getting that monoclonal antibody treatment. It's an infusion, so it's not like you can just go to the drugstore and pick it up. You do have to make an appointment. You have to get a prescription for it. But this has significantly reduced hospitalizations here in our state for the people who have received this treatment. That's the monoclonal antibody treatment. So we have sufficient supplies. If you're 65 years and older and you get that sniffle, please talk to your doctor about getting it. This is something that has really helped people fight the virus, especially folks who are in that 65 years and older category. Again, thank you all very much. I want to thank Tony and Ruth for coming in and talking about our property tax lookup tool. Appreciate it. Please encourage everybody to get familiar with that tool and use that to claim your property tax credit. And we will see you all again tomorrow morning at 9 a.m. Thanks very much. Thank you, Francis.